Welcome. We are happy to talk to you today about some tips for preparing for the oral exam. I have Dr. Kearney here with me, who I'm going to be asking some questions about preparing for the oral exam. So, Dr. Kearney, how did you go about preparing for the oral exam?
Well, first, Dr. Radico, I was very nervous. I think most people are pretty nervous when they first get started at this stage. I was happy to pass through the practice samples. What I went about doing is I got a general clinical health psychology textbook. I asked around for different book suggestions just so I could kind of do an overall read. And I read that over a few months period of time, made sure I was just up to snuff related to general things I wasn't treating all the time in integrated primary care. So I did a little bit about that. And then I kind of took a strategy in which I divided the different sections of the test and went about specific areas of preparation for each of those four sections: the ethics and legal issues, professional issues, the clinic case assessment intervention, and then just the practice samples.
Yeah, so you segued perfectly into our next set of questions here. Can you go section by section and share with us a little bit about how you prepared for each of the exam portions? So were there unique methods that you used to prepare for the ethical and legal issues portion?
Yeah, that's a great question. I think one of the first things I did was I went through and read specifically back through all the APA the standards and the principles. I actually studied those. I know that may seem a little silly, but I really wanted to make sure that off the top of my head, if I was given a scenario, that I would be able to identify the different areas from the APA ethical principles and guidelines. So that was one particular way that I did that. I also got particular books. There's lots of great books just about ethics applied to specific cases, both in kind of healthcare settings and not. And I had people kind of quiz me on that. So taking an ethics case scenario, and then I would just have them read from the book to me what that was, and then I would be working to identify that back. And that kind of helped to just see how good was I in picking up these different ethical situations quickly and then responding back to a partner on that. The other thing from legal issues is I also reviewed for my own state the guidelines from my state, both on ethics, but also kind of any legal issues that were unique to my particular state. And I also happen to practice in the VA setting, so looking along those lines about ethical and legal issues that may be unique for practice in my VA setting that other practitioners may not always come into contact with. And so that was the way I began to prepare for that.
Yeah, the case examples sound really critical and important to practice. Professional issues, how did you prepare for that section of the exam?
So to me, that was a little bit more tricky. So with professional issues, you're doing a lot of talking about your own particular setting of practice. So I went back and I read through my personal statement that I had attached also to my practice samples, and kind of tried to look at it from an angle of what would people perhaps be asking me from that write-up that I did, because a lot of times the examiners are kind of looking through that and asking specific questions. So making sure I was comfortable in articulating all of those different areas of practice that I was currently that setting in. The other thing that I did was also review a little bit about my practice outside of work. So how was I contributing to health psychology as a whole? Different organizations I was in, like Division 38, what were issues that they are currently tackling. I also wanted to look a little bit more broadly, looking at recent newsletters from these different organizations I was involved in, Collaborative Family Healthcare Association, things along those lines, to make sure I was up to date on current issues facing health psychologists in particular. And so that was a little bit of the harder section to prepare for, but I'll tell you, in my oral exam, it was one of the fun areas for me to actually do too.
Yeah, the memberships that you talked about, I think on the website that we have a list of those. So if any listeners are going, what is Division 38? That there is a page that lists out some of the frequent memberships that people might be interested in if they're interested in clinical health psychology.
Oh, great idea. I love that.
And so then can you tell us about the preparing for the standardized clinical case assessment and integration section?
So for me, one of the things was also you can bring into the exam kind of your clinical interview. And so I went back, made sure that I had a sound clinical health psychology interview applicable across different cases and settings. I asked other health psychologists for theirs as well and kind of did a cross comparison. Going back to the health psychology test, is there anything in my interview that I'm missing? Because I wanted to make sure that I was coming across a clean interview that covered everything that potentially I could be tested on. So that was one of the initial things I did. And the other is I asked other health psychologists to kind of help me, kind of create kind of a scenario, and then I would just kind of role play with them and see what kind of feedback they had for me about what am I missing, what am I not asking about, are there particular diagnoses that I may be overlooking, and are there interventions from the literature I'm missing, and trying to assess from that health psychology book, making sure I'd be comfortable in a wide range of areas for assessment and intervention, that I could at least speak a little bit more broadly about evidence-based interventions in those areas.
It sounds like utilizing the support of those who had completed board certification before you was really important in your process.
Yes, and helpful to have a mentor along the way as well.
Yeah. So last but not least, can you share with us how you prepared for the practice sample portion?
And that was really rereading through my materials, because at this point for me, it took a little bit of a while, about a year to go through. I wanted to make sure I reread that fully. And then also to see, I wanted to be comfortable to be able to cite things off the top of my head for literature supporting the types of interventions I used in my practice samples. So going back and rereading some of the articles that I cited was very helpful. And I also did another literature review to see, is there anything new coming in the literature that was not present at the time I did these interventions with patients that I would want to cite now. Particularly, I wanted to check back, is there anything, has there been anything that's changed as far as what we might advise for a patient in that setting, so that I could speak to that if I was being asked about it.
Yeah,
and that's it.
That's great. Thank you for sharing that with us. It's very useful, and we appreciate your time.
Absolutely, and good luck to everyone. It's not as bad as you think it is. And I will tell you, the oral exam process for me was really enjoyable and actually a little bit fun, if I can say so, Dr. Radico.
Well, thank you so much.
Thank you.